Well, the topic was fit and young patients. So normally we perform an autologous stem cell transplantation in this patient group because most of our studies suggest that that's the way to go. However, we're living in exciting times and there are a lot of new treatment options, and there are also in the new studies, of course. And with these new options, patients and also doctors ask themselves, is it still necessary to perform that autologous stem cell transplantation, the high-dose melphalan? And that's because, of course, it's a rather tough piece of the treatment for the patients. They have to be admitted to hospital. There are acute and also later side effects. So with the newer treatment options, maybe it's not necessary anymore to give them the autologous stem cell transplantation. That was what the topic was about. So what I try to show is that these options are promising. However, the studies are not that mature yet to state that it's better to leave the stem cell transplantation out. The conclusion was we have to be careful, but it's hopeful that these new treatment options generate really good response rates. Because clinical trials, it takes years before we can conclude something about the overall survival, because patients are living longer, and when they have a relapse, we have options, fortunately, to treat them again. So that's why overall survival data takes years to mature. And we're looking for alternatives, which can we use? And we can use two markers. One of them is the minimal residual disease, because that seems a surrogate marker for overall survival, and the other one is PFS2, so the progression-free survival in the treatment after first-line treatment seems also predictive for overall survival. And these markers are sooner available than the overall survival is.